Kenyans should be warned that the end is a long way coming. The recently announcement by the Ministry of Health Chief Administrative Secretary Rashid Aman announced 28 new positive cases that have been identified from about 841 samples. This brings the number of counties affected to 19 out of the possible 47. The CAS also announced that one more person has succumbed, bringing the tally to 33.
We take this opportunity to send our heartfelt condolences to the bereaved families and friends.
For the first time, we had somebody aged 30 to 39 dying. 33-year-old gentleman passed on. And remember, despite this group of people being the highest number in terms of the symptomatic cases, we have never had a mortality of somebody 30 to 39 years old.
The good news, however, is that 12 new recoveries were made in the last 24 hours, totaling 251. The question that pops on Kenyan minds is whether the numbers are a true reflection of the situation on the ground or to the fact that adequate mass testing is yet to be done. The ministry, however, assures that the country has the capacity for mass testing but only lacks testing reagents. Of the 28 cases, Mombasa has the highest number, being 10, followed closely by Kajiado with 9, then Nairobi with 7 and 2 from Wajir.
This brings to 700 the total number of those who have tested positive.
Mvita, Changamwe, Kisauni, Nyali and Likoni are the estates affected in Mombasa, while those of Nairobi being Kenyatta National Hospital, Embakasi, Kibra and Pumwani. In Wajir, the estates are Eldas and Tarbaj. The ministry has given stern warning to Kenyans who want to take advantage of the situation by purporting that they have traditional herbal medicines capable of curing the virus and urging Kenyans to keep a close watch on the right channels where they can get correct information.
We want to tell Kenyans that many of these products that are out there do not have any scientific evidence as to their effectiveness. But more importantly, we know that in a situation like this, there will be some who want to profiteer from this uncertainty by purveying products and claiming certain advantages to their products.
Community-based spread is by far the main way through which people get infections, especially in our country where most live in the suburb areas that are characterized by crowding, as well as use of shared amenities like bathrooms and sinks, thus making it difficult to adhere by the rules of social distancing. It is for this reason that the government aims at focusing all its efforts in curbing community-based spread in a measure to flatten the curve.
Our priority intervention measure in the new month is to limit community spread of the virus. Recognizing that the virus requires a sound public health response, we will fully support our frontline healthcare workers and other workers as well in providing technical expertise on case management as patients seek to address the community spread.
Border points have also been pointed out to be high-risk areas, as seen in the high numbers of cases recorded in Kajiado, all of whom are truck drivers who travel cross-border to Tanzania and back.
At the same time of testing truck drivers at Namanga, on the Kenyan side, that's the Kenyan drivers, we also test Tanzanian drivers who are intending to enter Kenya through that border. We provide a service to them. They are sampled while they are on their side of the border, and we conduct the test.
While speaking on behalf of the tourism sector, CS for Tourism Najib Balala announced that there will be no charges for compliance permit as well as for inspection, and that the ministry has subsidized the testing fee to 1,000 Kenyan shillings.
The cost of tasting for the businesses will be 1,000 Kenya shillings, and I want to thank the Ministry of Health because the actual cost of its of tasting cost up to 4,000 Kenya shillings, but we have subsidized as government because we want to support the economy.
Grace Swangoi, Hope TV News Watch.